Did you know that cleaning your ears the wrong way can lead to pain, dizziness, or even a ruptured eardrum? Many people use shower heads, syringes, or even water flossers to flush out earwax because they believe it's a safe and effective method. But is it really safe? In today's video, I'll explain how ear irrigation works, when it's appropriate, and when you should never attempt it. Let's begin by understanding how ear irrigation actually works. It is not about blasting earwax out with high-pressure water. Instead, warm water at about body temperature is gently directed along the wall of the ear canal to loosen and soften the wax. As the water flows back out, it carries the loosened earwax with it, making removal easier and more comfortable. When performed correctly, ear irrigation is usually simple, causes little discomfort, and can be very effective for removing soft earwax. However, the most important question is whether your ear is actually suitable for this procedure. Ear irrigation may be appropriate if the earwax is soft or only mildly hardened. The wax is causing a blocked sensation or temporary hearing loss. There are no signs of an ear infection. The eardrum is intact. You have never had ear surgery. If the earwax is very hard, doctors often recommend using earwax softening drops for 1 to 3 days before irrigation. This helps loosen the wax, making it easier and safer to remove. A typical ear irrigation procedure involves these steps. Step 1. Have your ear examined by a healthcare professional to make sure your eardrum is intact and there are no underlying ear problems. Step 2. If the wax is hard, use earwax softening drops as directed before the procedure. Step 3. Prepare clean water or sterile saline warm to approximately body temperature. Avoid using cold or hot water, as temperature extremes can trigger severe dizziness. Step 4. Gently straighten the ear canal. For adults, pull the outer ear upward and backward. For young children, gently pull it downward and backward. Step 5. Direct a gentle stream of water along the upper or back wall of the ear canal. Never spray water directly at the eardrum. Allow the water and loosened earwax to drain out naturally. Step 6. Afterward, the ear should be rechecked to ensure the wax has been completely removed, and the ear canal should be dried thoroughly. This is the most important part of today's video. Do not attempt ear irrigation if you have a perforated eardrum, an active middle ear infection or ear drainage, a history of ear surgery, ear tubes, tympanostomy tubes, severe ear pain, a foreign object in the ear, hearing in only one functional ear. In these situations, flushing water into the ear can make the problem significantly worse. In my ENT practice, I often see patients who have tried to remove earwax at home using large syringes, water flossers, shower heads, high-pressure spray bottles. These devices were never designed for cleaning the ear canal. Excessive water pressure can scratch the delicate skin inside the ear, cause bleeding, push the earwax deeper, or even damage the eardrum. Another common mistake is using cold water. Cold water can stimulate the balance organs inside the inner ear, leading to sudden dizziness, nausea, or loss of balance immediately after irrigation. Ear irrigation can be a safe and effective way to remove earwax, but only when it's performed correctly and on the right person. It is not a one-size-fits-all solution. Before attempting to flush your ears, it's essential to make sure your eardrum is intact and that you don't have an ear infection or any other underlying ear condition. If you're experiencing hearing loss, ringing in the ears, ear pain, or a persistent block sensation, don't try to solve the problem yourself. Instead, schedule an evaluation with an ENT specialist. Sometimes what appears to be a simple wax blockage can actually be a sign of a more serious condition. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss our latest videos on ear health and hearing care. Thanks for watching. I'm Dr. Tien Tran, and I'll see you in the next video.